Thanks. Ladies and gentlemen, this is the clerk with a courtesy announcement that this meeting is now being streamed live online.
Hi, Denise. Please check your email.
Hello, Supervisor.
Hey, Dave, how are you today?
I'm feeling okay. How are you?
Glad to hear it. Best day ever. Can't go backwards.
Fair enough. Hello, Deborah. Can we do a mic check, please?
Good afternoon. How are you?
Good afternoon. Thank you. We can hear you.
Okay, thank you.
Hello, Chairperson Chavez.
Hello, Dave, how are you?
I'm okay. Little under the weather, but I'm all right.
Oh, I'm sorry to hear that.
It's okay. We still have a couple of minutes before we can get started, so I'm going to just, I'll step out of the way and I'll start recording in a couple of minutes.
Thank you, appreciate you.
Thank you.
Thank you, Amy. And thanks, Denise.
Hey, Rob, would you like to do a mic check?
Yes. Hi, Dave. Can you hear me?
Yes, thank you.
Thanks.
Natalie, would you like to do a mic check?
Yes, can you hear me?
I can, thank you. Hey, Nick, would you like to do a mic check?
Good afternoon, everybody.
Good afternoon, thank you.
You're welcome.
Recording in progress.
Hi, Alexis, would you like to do a mic check?
Yeah, so
I'm getting an echo. Are you in the same room with another attendee?
yeah, we are. So we actually decided, hello everyone. We're going to use one computer. We strategized being able to have all of the microphones off so that we
Okay. Great, thank you. That'll help prevent feedback.
Thank you.
Madam Chair, whenever you're ready.
Great. Thank you so much. We will now begin the August 25th meeting of the Children's, Seniors, and Families Committee. I'm happy to be here with Supervisor Ellenberg, and I will ask our staff if they can take the roll.
Good afternoon, Vice Chairperson Ellenberg
I'm here.
and Chairperson Chavez.
Here,
Thank you.
We have a quorum. We'll now go
Yes,
to
we do.
public comment, and this is an opportunity to speak to an item that is not on the agenda, but within the purview of the committee.
All right, we currently have one speaker, Madam Chair. Give us a moment while we get the timer ready.
Great, thank you.
Waiting on that speaker timer to come up. One moment, please. Okay, there may be a connection issue with our speaker timer. I will do the screen share myself. Give me just one moment. Oh, there we go. Next speaker is Sparky Harlan. I'm unmuting you. Please accept the unmute. You will have 3 minutes to speak. The timer will start when you begin speaking.
Hi there, this is Sparky Harlan. I didn't realize I had 3 minutes instead of 2. I'm here basically to just talk about an incident that occurred at the hub on August 12th, where we had a young woman show up who is 21 years of age, a young African-American woman who's been in foster care since she was 16, is now 21, weighs under 100 pounds, but was experiencing an extreme mental health incident. We tried to work with her for about an hour, and things started going south when we called 988. And I know we don't have time to discuss or talk about it here, but I want to tell you, it ended up after 5 hours of having 13 police officers on site arresting this young woman. It was totally unnecessary to escalate at this level, but we could not get any mental health professionals out there. Police kept showing up. And the bad part about it at this point is she was arrested and put in Elmwood, has never had any criminal contact at all, and the DA is trying to press charges so that she gets charged with destruction of property. And I just want to say I would love to have us talk about this and how it broke down at all these places, and it's why our foster youth end up with criminal records. These are our kids. I say that all the time. We really need to talk about, especially now with what the DA is trying to do to charge her, to say, stop it. That's not necessary. And I know social services, social workers who are working with us on this too, and they don't want to see it escalated like this, but we really need to work together to make sure this never happens again to one of our foster children. It really did break down. Thank you, and I look forward to hearing back from people on this incident.
And that concludes our public speakers.
Thank you. We're going to move then to the approving the consent calendar. And on the consent calendar, Supervisor Ellenberg, may I start with you to see if there's anything you'd like to add to consent?
Yes, thank you so much. I'd like to recommend items 4, 5, and 14 for consent and offer just some very, very brief comments. Each of the reports was very clear and very helpful. Thank you. Thank you to staff. Item 4 is the annual report from the Kinship, Adoptive, and Foster Parent Association. To see all of the activities that KFPA supports for children and families in our community is truly impressive, and I'm really grateful for the role that they play as experienced and compassionate supporters for all of the parties engaged in the child welfare system, children, parents, resource families, and social workers. I do want to encourage the FCS to deepen that collaboration with KFPA, and my staff will be following up offline to discuss areas where our office and the county can continue to support this really excellent work. Item 5 is the report on timely medical and dental exams for children in the child welfare system. Again, the report was clear and reflects really good continued work. I particularly appreciated the attached off agenda outlining the process and work underway to expand clinic hours in the evenings, thank you, to improve access for youth and families. I'd like to direct that the next quarterly report on this topic provide a thorough update on the progress for expanding evening hours for dental and medical services. And finally, item 14 is the report on patient navigation services for the Pediatric Diagnostic Specialty Center. I am very happy with the progress in the past several months on collaborative planning around the service navigation. I appreciate the plans in this report to track outcomes for families, to refine and continue to improve supports. The report was clear on the metrics, and I'd like to direct that once the center opens, that the qualitative and quantitative findings of these assessments be reported to this committee as part of the quarterly updates. As I mentioned before, I think the service navigation issues will be one of the most challenging areas to sort through and really most critical to making sure families actually get connected to the supports that they need. I'd also encourage, to the extent that issues are identified that are policy barriers at either the state or local level, that those be documented and brought forward with recommendations to the board or to our intergovernmental relations team so that we can advocate for changes that support our families. And it would be my motion to approve the consent calendar with those items added and the direction given incorporated.
Thank you. I would like to second that, but with a couple of other additions. So I'd like to add item 12 also to this consent calendar. This is the position to oversee the VAS. And very simply, I'd like to give a direction to staff to reevaluate the program 3 position to make it a higher position, because it is a position that is coordinating with senior staff from other departments and other systems, including the medical system. To go back up to the Kafka annual report, I want to say, Denise, thank you to you and your incredible team. I do want to reinforce what Supervisor Ellenberg said about, in a deep and meaningful way, improving our relationship and making sure that we are both listening to foster families and parents, but also I want to make sure that we're taking into account that the education process, so that procedures are really well understood by all parties, and that really emphasizing that with the foster parents that we're working with. On the medical side, I'm also happy to support it. I just want to say thank you for the incredible work. We've come a long way in this area, and I just want to acknowledge the staff. I also want to encourage the report back on the evening hours and the process to getting us there. I do really want to, I just wanted to highlight that I'm looking forward to seeing the results of the Health Collaborative Work Group. I think that's going to be very informative in terms of how we proceed in the future. So thank you to all of our service providers in that area as well. So that would be my addition. Supervisor Ellenberg, is that acceptable to you?
Absolutely.
Thank you. So we have a motion and a second. We'll now go to public comment.
We currently have one speaker, Madam Chair. One moment while we get the timer up, please. The next speaker is Jane. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Thank you.
Jane, are you there?
I am, Dave. Thank you.
Go ahead.
Well, I really didn't have something to share necessarily on this. I was listening to Sparky's comment about the incident at the hub, and I've been following some of the 988 lack of, anyway, I was hoping to come in person. I've been attending meetings in Sacramento mostly, and I'm just recognizing how pharmaceutical interests branded themselves as in 2014 as California's mental health movement. And so I'm just been following the dysfunction in Sacramento and the Governor's Department of Finance and the Cal MHSA and the disillusion of our Department of Mental Health into all of these various siloed agencies. So I just want to begin to speak to that at the local county level, and I just appreciate Supervisor Ellenberg and Supervisor Chavez, and you're giving me that a little bit of time, David. Thank you.
And that concludes our public speakers.
Thank you, Jane. One last thing as we wrap up on the patient navigation, I do just want to say I'm very appreciative of all the work that's going in there. That's one of my most, I don't know. So well done. Keep going. No pressure. But I want to just emphasize what Supervisor Ellenberg said about making sure no one falls through the cracks. So with that, maybe you have a vote, please.
Vice Chairperson Ellenberg
Yes.
and Chairperson Chavez.
Yes.
Thank you.
Thank you very much. We're going to move to item 6 and Supervisor Ellenberg, I will just say, and to all of our presenters, I know working with Amy, she's given you some times that she wants you to be within, or Maya. And the reason for that is we have a number of really important issues that I know Supervisor Ellenberg and I ask a lot of questions. So I'm going to just ask everybody to be very focused on their time. So we're going to move to our agenda to the item 6, which is an update on the Universal Development Screening Initiative. And I know this is Susan, this is an important body of your work from your referral. And I don't know if you wanted to say anything before we got started.
No, I'm happy to have the brief report. Certainly, I've read all the documents, and as guest, yes, I do have a number of questions.
All right. So why don't we have the staff give a brief presentation, and then we'll jump into questions.
Good afternoon, Chairperson Chavez, Supervisor Ellenberg, Michelle De La Calle with the Office of System Integration and Transformation. I have a couple of folks with me today to help present from the expertise of our partners. We have Jennifer, the CEO at First Five. We have Alex from the California Children's Trust, and Catherine Margolis from UCSF, and they're going to talk a little bit about the revenue structure and some of those challenges there for the presentation. But I wanted to provide a couple of quick updates from the time of the report, and hopefully to answer some of the questions that might come up for you. One is that from the time of the writing of the report to now, we do have 2 community partner clinics on the books to meet with them to discuss potential collaboration. We're looking forward to having more on that information on that at our next report. The funding allocation was determined and will be in our office, and we're going to work with First Five to allocate that to make sure that we can support the cohort development through that funding process. So we want to make sure that we have that ability to flex those funds into the collaboration with and offset some of the costs that might be associated with the work we're doing internally in the county clinics to be utilized in a different way so that the community partners are able to manage their investments and build that cohort. So those are 2 components there. In terms of the recruitment process, we are currently in the recruitment process for the full-time LCSW. In the meantime, we do have a 0.5 or half-time part-time LCSW doing the work and developing the workflows with our teams to get that expertise up and running in real time. And we anticipate that in September, we'll be doing more work with that, especially around the 0 to 3, and then expanding once we get that the new LCSW starting in on the team. I think that's the updates that I have, and hopefully answered some of the questions. And now to address the more complex questions around revenue generation, we've invited Kate and Alex to do a brief presentation on that, and then we'll all be here to answer questions at the end. So Kate and Alex.
Thanks, you all. You didn't know it, but you were going to learn how to do Medicaid in 30 seconds or less today. So stick with me. Hi, everybody. My name is Alex Briscoe. I'm the principal of the California Children's Trust, but I come from county land. I was a therapist in the Oakland Public Schools, ran the emergency department at Children's Oakland, and for 12 years, I was the health director in Alameda County. And this is how Medicaid works. All of Medicaid is a federal dollar tied to a state dollar. And this is how it shows up in the lives of children and families. It comes through your managed care plans. You are a 2-plan county in Santa Clara. It comes through your county mental health departments. It comes through your school districts who can bill directly. It comes through your community health centers, your FQHCs, and it comes through your public health department, your public hospital, and the regional center. These are the 7 different intermediaries that support the mental health of children in the state of California. And a really big change is about to happen. If you want to distill the entire CalAIM initiative, it's to the centricity of your managed care plans in the future of Medicaid. The managed care plans in Santa Clara didn't have a mental health benefit until 2015. Today they do. And in January, they're going to get a really important mental health benefit to close one of the biggest gaps in your system, which is little kids. Kids 0 to 3 have the lowest rate of access to mental health services. Why? Because who would diagnose a kid who can't talk or walk? And because the way we bill and reimburse for mental health services is you have to have an identified patient and a diagnosis, but that's changing. And that changes what we're here to talk to you today about and the work we're doing with First 5 and your local health plans. First, and most importantly, low-income people interact with the healthcare system the most frequently in the first 3 years of their child's life. It's this extraordinary opportunity. Actually, we call them the well child visits. You did it, your kids did it, and low-income families do it. And it's a unique moment. If you've never been to Well Child Visit Day at a clinic, you should go. It's beautiful. Generally, it's the health system celebrating the wisdom and intelligence of low-income people and their child rearing. It's an amazing opportunity to do mental health services, but before this year, we couldn't. Why? Because you had to have a diagnosis, and babies don't go to the doctors by themselves. So when babies showed up, you couldn't treat mama because baby was the identified patient. Many of us, including Kate Margolis, who you hear from in a second, fundamentally shifted the entire Medicaid program. And in fact, California is the first Medicaid program in the nation to allow access to mental health support for an experience of racial discrimination, and now, beginning in January, caregiver mental health. So that's really what we're here to talk to you guys today about. I'm going to pass it off to Kate, who's literally the state's leading light on this work. I'm just a Medicaid geek, but it's our pleasure to work with you on this project. Oh, sorry. I had one more piece here, which is it's really important to focus on the benefits that we call the non-specialty mental health benefit. The growth of your mental health system for kids is going to come through the managed care plans. They're really important to focus on. Kate.
Thank you. Thank you, Alex. And I will just say, in addition to that, I am a clinician, a proud clinician at San Francisco General Hospital. I lead the integrated pediatric behavioral health services there. I do see families and babies every single week. So this work is very close to me. I do it every week. And so this is what we're working with. I'm going to get into the details. There's 2 things that really matter here. Number one is that we have a model. It is called the Healthy Steps model. It's evidence-based, tied to very important outcomes for child health. It exists. It's existed for a long time. And now the second most important point, as Alex mentioned, we have payment mechanisms for this. The key is that we need to ensure that the payment mechanisms maintain fidelity to the clinical model that we know works. That's how we see our primary job here. The graphic that you see here is a decision tree workflow that we have created in partnership with Tully to optimize the billing in a way that aligns with the Healthy Steps model. So the issue is, because I'm sure you've heard of the FQHC same-day exclusion, is that because traditionally we have not been able to get paid for in the most substantive way for a behavioral health service and a medical visit being offered on the same day, the temptation is to do only follow-up visits. And so one of the key components of the Healthy Steps model is to offer the behavioral health services while the families are already there. In the first year of life, it's a minimum of 7 times. So it's an incredible opportunity. So in addition, as of June 2021, when DHCS created the ability to pay for family therapy without having a diagnosable mental health condition, to be able to support parents during their child's well child visits, this is what changed everything. This model is active. It's already being reimbursed all over the state. And Valley Health Center, Primary Care Behavioral Health already has the infrastructure to bill for it. We're actively preparing Valley Health Center and tele staff now to start serving patients and billing the new benefit as of mid-September. So while the existing benefit gets us far, it doesn't get us all the way there, and that's where dyadic services comes into play. And so that's all the talk about the benefit that's coming in January of 2023. This is really important because currently we're limited by time. We have to deliver at least a 30-minute visit, and there does need to be a risk factor. We want to be able to deliver really evidence-based, proven to be effective, short interventions, sometimes even 10 minutes. The power of somebody going into the room with the pediatrician and asking the parent, how are you doing? This is a really hard job. Let's talk about how you're doing and how it feels like to be a parent of this child. And in the meantime, we are working on the same-day exclusions, making it so that we can maximize revenue so that we can provide same-day visits. And we're doing this. This is where it goes to this diagram that you're seeing. There's 4 different ways that we have developed and validated. The 3 black circles there all lead to getting the larger FQHC encounter rate payment. And we do this by leveraging the caregiver's account, looking at existing benefits, where we're able to provide health promotion services so that we get rid of the issue around having 2 of the same patients visits happening on the same day. One patient now is the caregiver, one patient is the child. So in addition to that, we use the newer benefits, which make up about 50% of the overall visits. And then that can also provide the larger same day or the larger FQHC payment. Most importantly, we're maintaining fidelity. We're faithful to the model that we know is most important for families, which is that you receive the service when you're already there and you don't have to make an extra trip. Finally, to the last slide, we've looked at staffing costs and reimbursement rates compared with tele-patient volume, and we've put together conservative revenue modeling. And what we see is that by the end of the first year, we start to generate revenue beyond the cost of the care. By year 2 and 3, we start to see significant growth. Just a note to say, this revenue modeling only takes into account those follow-up family therapy visits, not even payment for the same day visits, because we're still in process of validating really how much volume that creates. But even just in that one strategy of the 4 that you see in the previous diagram is where we start to see revenue beyond cost. And I'll stop there.
Michelle, I don't know if you want to facilitate questions or what the timing is.
Yeah, I wanted that to settle a little bit, and then we are here to answer questions about the program and about where we're heading.
Thank you. I'm going to turn to Supervisor. Supervisor, may I go to the public first, and then I'll come to us? All right. If there's anybody from the public would like to speak on this item?
We currently have 1 speaker, Madam Chair.
Thank you.
All right, 1 moment, please, while we get the timer up. Give us just 1 second, please. There we go. The next speaker is Jane. Jane, you have 2 minutes to speak. Please go ahead. Jane, I'm going to ask you to unmute. And
Okay.
go ahead, Jane.
Thank you, David. Yes, thank you, Catherine, and for the presentation and the fellow before you on Medicaid. I've been advocating for a non-clinical model because the clinical model is actually not correct for behavioral health. The psychosocial emotional model of the long time, decades old peer movement is more accurate for behavioral health. So I would like to, and I have been advocating for new education for our doctors in that regard with our public dollars. So because there's a lot in the non-public space, we have the Wisdom of Trauma film available now that we could provide for our is available for our behavioral health clinicians, but you know, that education for the doctors would be wonderful. And also, you know, the microbiome, you know, we know what supports the health of the microbiome, which also reduces the incidence of things like schizophrenia. So, I mean, this is available. So that's why I've been trying to work at the state level, because to, work with the governor and the senators to create legislation and budgetary support to support our doctors in a non-clinical model that's not appropriate and public miseducation for our low-income families, regarding behavioral health. But it's in pharmaceutical interests have been controlling the legislation. So anyway, thank you for listening.
And that concludes our public speakers.
Thank you, Dave. Thank you, Jane. I'm going to come back to Supervisor Ellenberg.
Thank you so much. Thank you for the report, Alex. You really just crushed it on making Medicare understandable and even a little bit entertaining, Medi-Cal. So thank you for that. I just want to get a quick check. I heard, Michelle, you start with the LCSW position. I understand that service delivery can't start until the position is filled. So you said that it's in process. Can you be any more specific? Are we talking about weeks or months yet?
We currently have a 0.5 that can start delivering services with the team until the full-time person is recruited. Let me see if I got the time frame on that.
Right, you did say
so we will begin
0.5
services as soon as we can on a limited basis. And I know that it's currently posted for recruitment right now.
Thanks so much. And given the focus on Tully's implementation of Healthy Steps, it wasn't clear to me in the ledge file whether PEARLS is being rolled out to all county pediatric clinics upon completion of the ACEs Aware training, or is that just happening at Tully?
We're currently locating that at Tully because of the comprehensive nature of the training for trauma-informed care. As we complete that at Tully, we may be able to roll that out further beyond Tully, but we're planning on rolling it out with the Healthy Steps model as we move through each clinic site.
Do you have a timeline?
I don't have a timeline yet. As soon as we kind of begin implementation and begin to kind of see how that works, we'll be preparing a recommendation for timelines.
Okay, great. Thank you. This question might be more for Kate and Alex. For the Tully site and others that join the cohort, can you review for us what the key indicators of pilot success would look like, and also what the cadence of reporting you expect to be?
Sure.
Sherry?
I can take that one. So we provide progress reports to First Five every 6 months, and those are open to be shared from our perspective. As part of our deliverables, we also every 6 months create sustainability reports where we're actually tracking the claims that have gone in against the cost. And so that's something that we will always be presenting to our stakeholders and partners and can be shared as well. Related to key indicators of success, I'm going to name some metrics. The first thing that I want to say, though, is that we're really interested in gathering information from our providers, staff, and most importantly, families. And we see really powerful feedback in terms of how this model feels to practice and to receive. So that's something we will be incorporating. In addition to that, engagement of additional sites is another one. Getting through the Healthy Steps onboarding process. And so currently the network agreements are being reviewed. And once those get signed, then we can actually do the virtual Healthy Steps Institute so that they can get trained in the evidence-based model. In addition to that, looking at an increase in the actual behavioral health visits for children 0 to 3, increase in claiming so that those visits actually do get billed at the health plan level for both the children and the caregivers that we are validating those approaches on. Establishment of data reporting mechanisms for the key metrics, which is already in process of being built at this time. And then finally, I'd say the infrastructure for Healthy Steps in Valley Health Center so that that can be scaled to other clinics.
Thanks. And I really appreciate hearing that the billing and revenues that would make these programs self-sustaining are going to be closely tracked. I think I heard you say that the data would be presented to First Five every 6 months. Is that accurate?
We submit formal progress reports every 6 months,
Okay.
and then we have other presentations for stakeholders in between.
I'd like them to be shared with this committee as well, simultaneously with First Five, so that we all have the same information, please. In prior discussions, I've pressed on the ability of the county to include additional sites in the cohort to make use of the generous technical assistance from UCSF. And you just sort of vaguely referenced it a little bit there. Have any additional potential county sites been identified? And if not, what is the timeline for that review and recommendation?
Outside of the county VHC sites, correct? Yeah, so we are meeting with 2 clinics in the next 2 weeks to further discuss and show the program and hopefully get their engagement and agreement and to move into the cohort. One site is doing their go live with a new electronic health record, so they're anticipating a delay there, and then we've had a couple of people decline involvement because of their go live with a new medical record.
Yeah, thanks. Somehow I thought there would be kind of a higher, faster uptake of this. I realize that it's a good chunk of additional work, but it's truly a best practice and of such value to families. I'd like in the next quarterly update to this committee, which I expect is November, to see a feasibility analysis of other county pediatric clinics that could be part of this, and we might have to, be a little bit more assertive and persuasive in getting more to join us. So, and I'm happy, Michelle, to support that in whatever way might be useful to you. Glad to talk about it with clinics. Glad to make my staff available. Let us know how we can be supportive.
Great, thank you.
Sure, and that's all I have. Thanks, Supervisor Chavez.
Thank you. I too wanted to just say thank you for how a bill becomes a law. That was so really, really well done. I just wanted to say, Michelle, to you and to the team, I can't imagine. I mean, I feel like billing has been the bane of our existence relative to mental health for so long and behavioral health, that just cracking this is so exciting. That, I'm really looking forward to better understanding how the implementation, really happens. And frankly, I think the point that Supervisor Ellenberg is raising around how this is going to be working with our partner clinics, especially those that, frankly, I know we're working with HealthLink, and there are other issues that are related there. And it's really kind of amazing how in behavioral health, the infrastructure has gotten in the way of the service in such a dramatic way for so long. So I do want to thank Catherine for your leadership in, doing your very best to remedy what appears to be one of the most, it's painful along the continuum of services that we're trying to provide for folks. So thank you for that. So I will look forward to the next report out. And I too am interested in the scaling. I'm also really interested in understanding if we're doing what we need to do to actually draw down those funds. And what I mean by that, Michelle, is that that we're able to really determine the sustainability of the model as it expands. Great. All right. Thank you so much.
Thank
and
you.
I don't think we need to take an action on this. Gave some feedback. So thanks all. Appreciate you being with us.
Thank you.
All right. We're going to move to item 7, and this is to receive a report from the Office of Women's Policy relating to When Young Moms Thrive pilot program by the Young Women's Freedom Center. I'd like to thank the Young Women's Freedom Center and Alliance for Girls for bringing the need of this pilot to my attention. And you get to see the fruits of your labor, your advocacy turned into change. I also want to thank my board colleagues for their gracious support of the referral that launched this to close the equity gaps in employment and empowerment of marginalized young moms in East San Jose and Gilroy between the ages of 12 and 26. At this time, I would really like to hand it over to Dr. Dr. Luna, to let us know who is presenting and where are we starting. Now I realize I don't see Dr. Luna.
I'm here, but I think I'd like to hand it over to Kitsal, who's done a fabulous job of shepherding this work. So I want to make sure that we acknowledge her, and she will be presenting, introducing the presenters. Thank you.
Excellent. Thank you. Thank you, Quetzal. Welcome.
Of course, thank you. Hello, Supervisor Chavez and Supervisor Ellenberg. Thank you for having us today. I am Quetzal Gomez, Management Analyst with the Office of Women's Policy within the Division of Equity and Social Justice. I oversaw the When Young Moms Thrive pilot program with the Young Women's Freedom Center. I am joined today by Desiree Victor, who is a Santa Clara County Site Director for the Young Women's Freedom Center, Alexis Roman, who's the Senior Program Manager at the Young Women's Freedom Center, and Arabella Guevara and Viviana Arenas, who were fellows in this pilot program. We're also joined by our Deputy County Executive, Dr. Lucia Luna. I'll be passing the mic to the Young Women's Freedom Center to go over the presentation, but I will stay on for any logistical questions you may have, and Lucia will stay on for any questions that y'all may have on next steps. Alexis?
Thank you, Quetzal. I'm just sharing my screen to share the presentation. Can everyone see my screen?
Yes.
Awesome. Great, thank you. Good afternoon, everyone. I'm Alexis Roman. My pronouns are she, her, ella, and I'm the Senior Programs Manager here at the Young Women's Freedom Center in Santa Clara County. I did want to take this time to uplift the contributions of Halima Barucha, who was a former Senior Advocacy Manager for Alliance for Girls. I also wanted to thank all of our coalition partners who supported us throughout this initiative. I'm here speaking with gratitude, having worked alongside all of these powerful, inspiring young mothers and research fellows, Jocelyn Aguilar, Priscilla, Anastasia, and Jocelyn Arenas. I'm honored to hand it over to our amazing research fellows who will take over the rest of the presentation.
Hi, my name is Arabella. My pronouns are she, her, and I'm a research fellow for When Young Moms Thrive at the Young Women's Freedom Center. The Young Women's Freedom Center is a nonprofit organization that works to decriminalize and decarcerate young women, girls, trans, and gender nonconforming folks all over California. We build community leaders and make long-term investments in young women. We do reduce recidivism, provide support, healing, and educational and economic opportunities.
Hi, my name is Viviana Arenas. I'm the Senior Advocacy Fellow at Alliance for Girls, and I was hired on to lead the work of the When Young Moms Thrive policy memo. At Alliance for Girls, we work collectively with schools and organizations to create more equitable communities through girl-driven research and recommendations. With the strength of our membership of 120 girl organizations and 60 girls champions, we facilitate collective advocacy to ensure policies and budgets reflect the needs and solutions girls identify for themselves to create safer environments where every girl can thrive.
We began When Young Moms Thrive to bring young moms ages 12 to 26 living in Santa Clara County together to reframe common stereotypes and shed light on the social structures and systemic barriers challenging young moms across California. This was done through YPAR, a youth-led participatory action research project. In order to better understand and provide recommendations to meet the needs of young moms, 5 of us research fellows took the lead on asking the central questions, which were, what is your experience being a young mother in Santa Clara County? What is difficult and what is working? Through these sessions, the young moms shared their experiences while navigating childcare, stigmas, mental health, COVID-19, and economic stability. Through coding, we captured the realities for young moms and the impacts these barriers place on their children and families. Out of the 158 moms that helped conduct this research, 148 of them were system impacted. 69 were less than 20 years old. 67 of them were unemployed. 67% of them were the sole providers for their children, and 65% identified as Hispanic or Latino. From this research, we found that childcare is the main struggle for young moms. They face barriers such as enrollment requirements that restrict underage moms, transportation, schedules, and more. Moms express that this impacts their mental health, education, and ability to find and retain work. The team analyzed this data for the last year while working with 158 young mothers to develop policy recommendations and address the barriers they face.
The research conducted through the study, as well as outside research, suggests that access to childcare and economic opportunities is a common barrier for many families. The 5 recommendations listed here represent and highly reflect the findings in the studies. If implemented, each recommendation will create a positive multi-generational impact that will allow new pathways for families to access the resources they need to thrive. To learn more about how to implement these key recommendations and why they are so important, please join our mailing list to read the full report and policy memo, and as we consider our next steps. Our hope is to uplift the findings and recommendations to policymakers at the local and state level. We want to shift the narrative for young parents, and we hope to have your support along the way. Thank you. This concludes our report. We appreciate the committee for centering young parents in Santa Clara County and uplifting the work. Now we'll pass it back to Kitzel from the Office of Women's Policy to take it from here.
Thank you all. That concludes our presentation. We're ready for any questions.
Well, first of all, amazing job. The report was really well done and so well written and really concise and honestly, and you did it all within the time frame. I'm going to just say to all of my county colleagues, watch these ladies. This is how it gets done. What we're going to do is we're going to take public comment first, and then we'll come back to the committee for discussion. So if there's anybody who would like to speak from the public.
It looks like we currently have 3 speakers, Madam Chair. One moment, please, while we get the timer ready. Pardon me. Next speaker is Mindy Asperer. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, everyone. My name is Mindy. I'm the Young Parent Program Manager over at Planned Parenthood Marmonte. First of all, I would like to acknowledge the County of Santa Clara, the board, the Young Women's Freedom Center, AFG, and most importantly, all the youth researchers and fellows who really put all their time and effort into this policy memo. I really can't put enough emotion into how important this work was. Being a young parent myself, now my daughter's 16. It's bittersweet to see that we're still trying to have some equity in the sense in this area. And so again, thank you all for giving them the opportunity last year to initiate this memo. And I do want to highlight that this is something that even today, recently, working with case managers on my team, we have clients right now who are at home waiting to go to school and work, who are actively enrolled in high school in Santa Clara County, but cannot attend because they don't have childcare. And this leads to so many things, the isolation, mental health challenges, financial challenges, even food access. And so I, again, thank y'all for this opportunity to present, and great work, everyone.
Next speaker is Tuyen Fiak. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, thank you very much. My name is Twin Fiag. I'm the Director of Social Justice at the YWCA. And thank you to the Board of Supervisors who approved this. This was a wonderful project, and it was great getting to know some of these women and seeing the powerful work that they do. My comment is the YWCA created a childcare teacher apprenticeship program in January of 2020 with 10 people. We collaborated with Cal State Stanislaus to design a 6-month training program that provided the necessary 12 ECE units and receive on-the-job training in a licensed childcare facility. As a teacher's aide, trainees started a living wage with the YWCA. Once the trainees graduate from the program, they immediately receive a 12.5% raise as a child care center teacher. Graduates of the program are also able to use the credits they earn to work in any licensed facility or work towards a credentialed teacher degree. Out of the cohort of 10 that we hired, 6 are still employed by the YWCA 2 years later. So we know that this model works. The YWCA fully supports the recommendations from the Young Women's Thrive report that surfaced trusted and affordable childcare as a key barrier for young moms to thrive. Affordable and reliable childcare is a national crisis that's keeping women out of the workforce. Creative apprenticeship programs like the YWCA's Childcare Teacher Credential provide solutions to support women's development by closing equity gaps, employment training opportunities, and supporting the empowerment of marginalized young moms. Thank you.
Next speaker is Lorena Zermeño. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Good afternoon. My name is Lorena Garcia Cermeño, and I'm the Policy Manager with California Latinas for Reproductive Justice. I'm honored to speak in support of the incredible and innovative work of the When Young Moms Thrive campaign in uplifting young families and collectively identifying critical recommendations to ensure young parents and their children have the support and resources they need to thrive. CLRJ is a statewide organization committed to honoring the experiences of Latinas, Latinxes to uphold our dignity, our bodies, sexuality, and families. We build Latinas, Latinxes power and cultivate leadership through community education, policy advocacy, and community-informed research to achieve reproductive justice. We are committed to advancing this work and centering young parents in the discussion and creation of policies and practices to uphold the health, dignity, and well-being of all young families in the state. Thank you so much for the Santa Clara County Board of Supervisors for your leadership on this issue. And also wanted to express joy in the fact that this presentation is currently taking place on California's recognized California Young Parents Day. So we just wanted to honor and celebrate all of the young parents and their families in this space today. Thank you.
The next speaker is Jocelyn Arenas. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Hi, everyone. My name is Jocelyn Arenas. My pronouns are she, her, and hers. I'm actually also a research fellow with the Young Women's Freedom Center for the When Young Moms Thrive project. I just wanted to say that I myself am a young parent, and I would like to say that finding like resources and everything was really hard when I first got pregnant and after having my baby. And I don't think I would have been able to do it without the resources that there was, like the program Teen Success or Teen Parenting by Planned Parenthood. And I would just like to say that all the partners in this like really helped me when I was going through a lot of struggles throughout parenting. So I think that the work that's been done is really important. And I think that everybody that's done the work really did put their heart into it. And I think that everything that's in the report and all the quotes and everything that we got from the young parents who participated in this, like it's important and like it shouldn't be taken lightly, and just know that like these things are based off of like real people, real stories, and like the real struggles that they face. And that's all. Thank you.
Next speaker is Sia. You have 2 minutes to speak. Please go ahead.
Hi, my name is Priscilla Uregas. I am a research fellow with the Young Moms Thrive, and I just wanted to say that thank you so much for the young moms that really helped, and everyone in the community that has helped bring this policy memo together. And I just wanted to say thank you, Alexis Roman, for helping us organize this policy memo. And without the young moms, none of us could have achieved this work, and we wouldn't be able to do this without the help of our community. And this is not just in our communities, but many other communities. And the needs are very much critical for our lives, and not just for our lives, our children's lives as well, and creating sustainability also for many other generations to come. So thank you so much for giving us this opportunity to speak up about the struggles that we experience. And being a young mom, being a new mom and a first-time mom, I couldn't have done this without the Young Women's Freedom Center. So I just really want to shout you guys out. Thank you so much.
And that concludes our public speakers.
Thank you very much. And, you know, first I want to just honor a couple of women, and that's both Halima and Desiree. I thought you both did, and really this isn't the only issue you brought to the board, and the partnership with both of your organizations, but the two leaders, I just wanted to lift up and acknowledge. So thank you for all that amazing work. I want to turn for a moment to Dr. Luna and ask this question. How do you want to incorporate this report into the work of the and I guess the Office of Women's Policy or the, Office of Gender-Based Violence, what's your thinking of, not gender-based violence, but what's your thinking about where you'd like this to go, Dr. Luna?
I think that the natural place is both sort of working together somewhere between the Office of Women's Policy and, of course, our new Office of Families and Children's Policy, where we know that childcare is going to be and is, one of the highest priorities of the office. So we will be taking this information and looking to see sort of how we can develop some implementation objectives associated with this, and then integrating them both into the work plans for the Office of Women's Policy and, of course, also the office led by Sarah Duffy. And the parts that speak to the universal basic income, we want to definitely connect those to what is already happening in multiple places led by social services and other partners. So we will be taking this information back and developing implementation plans, and of course working with our partners here to help us ensure that we're moving in the right direction. So those are our plans after this report.
So Dr. Luna, and welcome Sarah. I just saw you pop up. I don't think I. Thank you. Yay, welcome. You've been anticipated, highly anticipated. So it's exciting to see you here. Here's a couple of recommendations that I would like to make. One is that I think I'd like staff to come back with a plan for continued and compensated involvement from the Young Women's Freedom Center and participating moms is an imperative to the development of the implementation plan. I recognize this is a collaboration between two nonprofits, so however you all determine is the most appropriate way to proceed. I know Alliance for Girls did a lot to get us here, so I want to make sure I'm not leaving anyone out, but I want to make sure that we have a plan for continued compensated involvement. So that's the first thing. The second thing is that I'm very interested in this program giving us direct feedback about the implementation, both the development and the implementation of the plan. I think one of the challenges that we have is that we often get input at one point in the process and then disengage in a way that often, frankly, we get off our track, and then we don't understand why people aren't, engaging in the programs that we're developing. So I think this is one of the really important opportunities we have for client-centered design, and could be something that we continue to look at as a core tool to our program development. I think, Dr. Luna, you in the public health department have a lot more experience with that client-centered approach. And that said, I think it's something that needs to be really woven into all of the different institutions within the county. So I think this is an opportunity to do that. So what I'd like to request is that the staff consult with the Young Women's Freedom Center and the collaboration, and report back to us in September with information on how we can continue this program with this continued compensated involvement in the development and implementation of the recommendations that are brought forward, and concretely the placement in what office and what that actually looks like. Because well, all the reasons. I was kind of preaching to the choir there. So that would be my motion. If I could ask Supervisor Ellenberg for her feedback.
I absolutely would second that. It is such a tremendous asset to us to have this coalition to actually make sure that we get this right, and that what we're doing is not theoretical work, but that it is actually centered on needs. So delighted to second it. Did you have more that you wanted to add, Supervisor Chavez?
As always, but why don't I let you jump in? I saw you leaning in, so
I was so taken with the report and then with the verbal presentation today. So I thank all of you. I certainly could not agree more with the emphasis on childcare. It really is the core of economic stability and economic advancement. I did have a question, which is a very narrow one, but but in thinking about all of our potential partners, do all, so one of the young women mentioned that getting to school is hard, high school without childcare. Does every school district have at least, that's a high school, have at least one comprehensive high school that has on-site childcare? Does anybody know? If not, we'll find. I know San Jose Unified has it at Broadway, but Broadway is a continuation high school. I don't know that it's a comprehensive school, but that to me seems like such a low bar that this service should be available in
Supervisor
every
Ellenberg,
school.
I definitely will follow up.
Okay.
Years and years ago, every school district had at least one site and or would partner together to have that option, but I don't know where we are today, but we'll
Okay.
definitely circle back. And,
I would like to know that, because I thought all of the recommendations were solid, and we should really be incorporating them and thinking about how we implement. But so that one just really stuck out to me as something that should be happening, and we should be talking with school districts to see why it is, why it isn't, why it isn't, where it isn't. Viviana, did you have an answer for me or thought about that? I saw you wave.
We're just going to chime in, but Dr. Luna already answered.
Okay. All right. Thank you. And I would again just emphasize the importance of continuing to engage with all of you as consultants and advisors. Thanks again.
Thank you. And the one thing that I just realized is that when the follow-up happens, it may also be beneficial to have somebody, I forgot who the contact person is at the County Office of Education who's been helping us with our childcare strategies, but it would be great if they could also participate in the follow-up discussions, because I think what Supervisor Ellenberg raises is a really good point just about that delta, particularly where we're talking about the younger mothers. So thank you for that. Excellent. All right. So with that, we're going to take a motion to give direction to staff to come back to us in September after consulting with the Young Women's Freedom Center and the collaborative, and with the Alliance for Girls, to come back with a strategy for continued and compensated involvement in the development of the implementation plan for the recommendations they brought forward, and to include the County Office of Education in those discussions so that it's a complete picture.
I want to be happy always to have the County Office of Education. But again, since each school district really has independence to implement their own programs, we need to be reaching out to any school districts with a high school component in them directly.
Yeah, that's an excellent point. And Supervisor, what I was really thinking about is getting the person who's the liaison there. I just thought they might have information for the initial discussions, but I think you're 100% right that really building those relationships directly is going to be really critical so that we understand what's happening on the ground. So, well,
Absolutely.
excellent. All right, I will ask for a roll call vote.
Vice Chairperson Ellenberg.
Yes.
My apologies for the timing on that. And Chairperson Chavez.
Yes, thank you.
Thank you.
Thank you all. Great job. All right, we're going to move on to item 8. And item 8, I'm going to turn this over, I believe, to Carla. Yes, there she is.
Hi there.
This is relating to the salaries for gender-based violence advocates. This is in response to the 2021 Human Trafficking Commission recommendation and referrals that were done on January 25th and the 19th at board direction. And Carla, I'm going to hand this over to you to get us started.
Great, thank you so much. So I hope I'm sharing my screen and you can see.
You are.
Okay, perfect. So this will be a really brief update, and as you said, it's in response to the referral in January. And when we presented in April to the board on 3 of the items, one of which was challenges to the recruitment and retention and the salaries of confidential advocates, and we were asked to report back, and here we are. So let me get this going. There we go. So we partnered with the Domestic Violence Advocacy Consortium, which is a group of 5 local agencies that provide confidential advocates for survivors of domestic violence and/or human trafficking and/or sexual assault. And in April, DVAC provided a memo, which is also attached to this report, and they highlighted some of their staffing challenges. Now, this included things like aligning pay equity standards across diverse funding, salaries not competitive with either local government or the private sector, compression challenges for other staff, the high need for bilingual and bicultural staff, and the limited ability to spend funds generated by staffing gaps. So staff outreach to national, state, and regional sources, all of which confirmed that the issues around staff recruitment, retention, and pay are not unique to Santa Clara County. We would argue that perhaps they're even more difficult given the cost of living in this area, but these are really issues that are happening around the nation. And they're also not unique to advocates because we know this because we partner with direct service providers and law enforcement, and there too, we hear constantly about the impact of COVID and the Great Resignation, and that all of this work is emotionally hard work that often demands very long hours and round-the-clock support. So we noted in April that the data was insufficient at that time to determine to what extent pay impacts service provision, staffing recruitment, and retention, and that further assessment is needed to understand how salaries are set for advocates, what education and experience requirements are required, and the pros and cons of the professionalizing the field, and if this impacts salary. So attachment B of this report shows some important distinctions between community-based and system-based advocacy, particularly around confidentiality. And yet, despite all of that research, there is much that complicates this issue. There is no national standard on advocate salary, and there are no clear or linear solutions for advocate salaries. And in California, the standard is the baseline level of training required. So I'd also like to point you to the August 19 memo from DVAC that is also attached to this report. And that summarizes confidentiality and the standardization that is part of community-based advocates, and how those who receive federal funds, all of which our local agencies do, have some of the strongest confidentiality obligations that exist in the country. So in the April 19th memo from DVAC, they outlined 3 recommendations that they believe would support them in addressing these issues. We've met with all members and tried to review some and find some paths forward. So what I'll do quickly is share a bit of the data we're using and how we're depending on data to move forward. The first recommendation was to increase funding, including payroll-related costs and indirect costs. However, we note that the county is currently funding millions of dollars and over $7 million just in direct services, and that these were all administered through open and competitive processes, that the budgets are proposed by contractors and the contracts are negotiated in good faith. Further, the CVOs have the discretion to adjust budgets inclusive of personnel and to submit bids that meet the parameters of the solicitation. Their second recommendation was to ensure ongoing COLA adjustments, and some of our contracts do have those adjustments, but some don't. And in FY23, our county executive implemented a 4% cost of doing business increase over the entirety of the contract for direct service contracts that met certain criteria, of which all of these contracts do. Some of those criteria are things like utilizing at least 85% of the prior year contract. We also want to note that future increases can be included in proposed budgets and negotiated through the RFP process. So finally, there was a recommendation to increase flexibility that allows, for example, for a mid-year budget modification when salary savings due to unfilled positions can be moved to other line items, things like client assistance, operating, and indirect costs. So since April, we have expanded the list of pre-approved items for emergency funds to all of our gender-based violence contracts. And this is great because this means that money is being utilized directly to the clients. We also discussed with them how budget modifications are already available through the current process, noting that it really is, in our view, inappropriate for a blanket approval, but needs to remain on a case-by-case review, so that we can ensure that proper use of public funds is happening and that we can ensure the original needs that were negotiated are still met. For us, this is about centering the focus on survivors in the need and not on any one agency. What we do have is existing board policy, things like policy against wage theft or policy for living wage requirements for workers. Even those CBOs are currently exempt from living wage requirements. And we also have the transparent competitive procurement processes and procurement policy so that ultimately the CBOs hold the autonomy to set their salaries for their staff. So county staff strongly believes and advises that this is how it should be. So that said, this slide shows a current snapshot of positions of advocates in Santa Clara County, and this information was provided by DVAC for us. And agencies are experiencing 23% vacancy for advocates. So we're currently looking at the data, and what we're seeing is that their salaries are within the living wage range that is set by the national standard, and it's been adopted by the county. What we don't know is how many are paid at the highest and how many might be at the lowest. So to keep strengthening our relationships and to increase trust with our CBOs, we've recommended staff to have monthly meetings moving forward to address challenges and opportunities, to discuss emerging needs, and to review spending and budgets to prepare for any increases requested from the community, and then to navigate the existing proper county budget processes together. We're grateful for the openness and willingness to work together that DVAC has demonstrated, and we believe that these monthly check-ins will strengthen everyone's ability to address the very real issues around advocate recruitment, retention, and salaries. And this actually ends this very brief presentation. So I'll stop sharing my screen. But of course, we can answer any questions.
Well, thank you. First, I'm going to see if there's anybody from the public who would like to speak.
We do have a public speaker, Madam Chair. We have a couple. It looks like we have a few hands raised now. So we'll get the timer ready. One moment, please.
We're going to go, folks, if we stay under, I forgot what our rule is, but, 2 minutes, good. All right, thank you.
Okay, next speaker is Adriana Marquez. I'm unmuting you. You have 2 minutes to speak. Please go ahead.
Hi, good afternoon. My name is Adriana Marquez. I am with Community Solutions, and I wanted to talk about how, because the county does not prescribe salary ranges, like I was mentioned, right, for DVAC agencies. It's within DVAC agencies to purview to increase the advocate salaries. However, increasing the advocate salaries without increased county funding to cover operating and admin will require reducing staffing levels. So as a result, DVAC service providers would be unable to meet the current need for advocacy and support services to survivors of gender-based violence. Most of the agencies have unfilled positions, as you can see, 23%. It's for extended periods of times. We're also experiencing high turnover. And we believe the reason we're struggling to recruit and retain staff is that the salaries we currently offer are not competitive. We do want to thank the board and the Office of Gender-Based Violence Prevention for your continued support of survivors, and urge the board to consider an increase in investment in gender-based violence services and prevention to $12 million. Thank you so much for your time.
Next speaker is Lindsey Mansfield. I'm unmuting you. You have 2 minutes to speak. Please go ahead.
Good afternoon, supervisors. My name is Lindsey Mansfield. I'm the Director of Healing and Justice with the YWCA. Advocates are the lifeblood of our county support system for survivors of gender-based violence. We cannot provide services without advocates and case managers, and it's become increasingly difficult to recruit and retain qualified advocates, as you've heard. This is not unique to Santa Clara County. It's a trend the field is seeing across the state of California. It shouldn't be surprising that during a time when we've all experienced the trauma of a global pandemic, jobs that include high rates of vicarious trauma and burnout have been difficult to fill. Of the staff that left the YWCA over the last 16 months, the top 3 reasons were that they were moving out of the area, considering a change of career, or they had experienced personal trauma themselves. In addition, our county has unique factors that our victim service agencies are struggling to manage. Due to the non-competitive wages relative to the public and the for-profit world, the high cost of living in Silicon Valley, we don't have enough staff to help everyone who's coming to our doors. YWCA knows what we need, and we encourage an intentional gaps analysis around advocate staffing across the 5 victim service agencies. As always, we really appreciate your time and consideration and your continued support for survivors in our community. Thank you.
Next speaker is Lydia Alcala. You have 2 minutes to speak. Please go ahead. Lydia, are you there? Lydia, it looks like you're unmuted, but we can't hear you. Okay, we'll come back to Lydia. Next speaker is Kim Gutierrez. I'm unmuting you. You have 2 minutes to speak. Please go ahead.
Thank you and good afternoon. My name is Kim Gutierrez, Anti-Human Trafficking Services Program Director at Community Solutions. I appreciate the time to address salaries for confidential victim advocates providing crucial services to survivors of intimate partner violence, sexual assault, and/or human trafficking in Santa Clara County. In addition to upholding confidentiality, privacy, and privilege laws, confidential service providers maintain 24/7 services and support survivors from crisis to stabilization and sustainability. The continuum of care for survivors includes support for basic needs and safety, as well as self-sufficiency programming, housing access, linkage to other resources, therapy services, etc. On average, confidential service providers work with survivors for 3 to 5 years. Confidential service providers have also historically stepped in, identifying and filling service gaps identified by survivors. The IPV strangulation response ensures that individuals who have experienced strangulation by an abusive intimate partner are able to access medical care, confidential advocacy services, and information about the reporting process or direct connection to law enforcement to make the report. This is also true of human trafficking survivors and commercially sexually exploited children. While it does take a multidisciplinary effort to support survivors, confidential service providers are not the same as community-based advocates or victim witness advocates. Each advocate has their own role and purpose, but are not interchangeable with confidential service providers. I want to thank the board and the Office of Gender-Based Violence Prevention for your continued support of survivors and urge the board to consider increasing its investment in gender-based violence services and prevention. Thank you.
Next speaker is Melissa Luke. You have 2 minutes to speak. Please go ahead.
Good afternoon. My name is Melissa Luke, and I'm the Chief Program Officer, Healing and Justice with the YWCA Golden Gate Silicon Valley. Thank you to the committee for your time and attention to this issue. Recruitment and retention in general is a complex challenge, and the more so due to the unique requirements for gender-based violence services. For example, county contracts require advocates to respond to a sexual assault forensic exam at VMC within 30 minutes, which is really 15 minutes with traffic and parking. How many advocates do we think can afford to live within 15 minutes at VMC? Complex problems require us to stretch outside of business as usual and consider creative solutions. Some areas where we could stretch: increasing flexibility around budget modifications, explicitly allowing agencies to adjust funding between personnel and operating would allow us to better manage staffing gaps and would align with federal and state. We could also engage in a more nuanced conversation around salary levels. Today's report notes that CBOs hold autonomy to set salaries for their personnel. It's true that CBOs have discretion to set budgets inclusive of higher wages. However, to increase salaries, we would need to reduce the total staff allocated to a contract and serve fewer survivors. I'm going to guess that no one at this meeting wants us to serve fewer survivors. At current levels, we are playing a zero-sum game. Current funding levels. We appreciate Supervisor Chavez and Supervisor Ellenberg's directive for the county to consider increasing staff on the victim side to keep up with increases on the criminal side. Per today's staff report, if the data shows a need for an increase in services, contracts may be adjusted and amended to meet the community needs. As my colleague Adriana will share, the data shows the need. It's here, it's now, And we look forward to working with you to address it as we pursue equity, justice, and healing for survivors of gender-based violence.
Next speaker is Adriana Caldera. You have 2 minutes to speak. Please go ahead.
Thank you. My name is Adriana Caldera, and I have the honor of serving as CEO for YWCA. I want to thank the supervisors and the board for your previous investments in critical services for survivors of gender-based violence and for your recent investments in support of the needs to support the Child Advocacy Center. As we celebrate progress made, we would also like to highlight the work that still needs to be done. Last year, YWCA provided 959 in-person responses. This was a 167% increase from the year before and a 48% increase from our pre-pandemic levels. Our services don't stop after our initial in-person response. On average, 80% of survivors want ongoing services with a confidential advocate. As of today, the YWCA has 59 adult survivors waiting to see a crisis counselor and 25 adult sexual assault survivors waiting for case management and ongoing advocacy, with no staff to meet that need. As demand has risen, every nonprofit, including the YWCA, has also had to manage the impacts of the Great Resignation. Out of a total 61 advocates that the organization has, we have experienced a 26% vacancy rate. The advocates that remain have more than full caseloads, which leads to burnout, which leads to more vacancies, and which leads to survivors waiting to receive critical services. This cycle is at the heart of our advocate recruitment and retention challenges and a key issue that we need to resolve. I want to thank the board and the Office of Gender-Based Violence Prevention for the space to have this conversation today and for continuing to support survivors and the staff who support them. Thank you.
We're going to go back to Lydia Alcala. We'll try you one more time. You're unmuted. You have 2 minutes to speak. Please go ahead.
Hi, can you hear me?
Yes, but there's an echo.
Good afternoon, supervisors. My name is Lydia Alcala, and I work at Community Solutions as the Sexual Assault Program Supervisor. I would like to speak about the county's comment about professionalizing the workforce with specific needs to ensuring all advocates have college degrees. Across the behavioral health system, we have seen how systems equitably treat and pay those with lived experience, such as our peer partners and staff within the substance abuse field. For instance, at Community Solutions and our behavioral health programs, all of our peer partners are paid the same rates as our case managers. It is important we see all advocates as professionals no matter the door they walk through. Whether that be lived experience, working professionals with years of experience in supporting individuals, or by attending college and receiving a degree. So I challenge us to broaden our understanding of what decrees someone as a professional. Thank you for your time.
Next speaker is Irvish. You have 2 minutes. Please go ahead.
Thank you very much for to Board of Supervisors, as well as Board of Supervisors, especially Cindy Chavez and Ellen. Excuse me. Again, thank you very much to Board of Supervisors. I wanted to emphasize on the fact, the fact about what we are dealing with in terms of a supply versus demand question. And we are trying to solve a problem of a complex society and providing a simplified solution. It's always going to be a case that we come across and net across a situation where we have to reform, apply the legislative processes, and as well as niche the issues that prevailing within the system, the gender-based violence, as well as the human trafficking, sexual harassment, providing the benefited services for the behavioral and mental health. These are some of the challenges that we face on a day-to-day basis with the types of people, as well as the type of a service that is required for the better health and the better education within the county. I wanted to again, acknowledge the fact about that, how the efforts are being pioneering. However, it is equally important to ensure that we align our efforts along with the reports that have been received, because most of the time we come across a situation that we deal with the different issues, but we hardly get the symptoms of a data. For example, I wanted to emphasize again about the HIV Commission's report about the last 3 years, different data analysis about how many people are being served for the HIV, and as well as the different public health services through the public health departments. So I wanted to acknowledge that part, and I also wanted to acknowledge about the presentation that's been provided. So thank you very much again for consideration of comments.
Next speaker is Perla Flores. You have 2 minutes to speak. Please go ahead.
Guitarist with Community Solutions. And first, I want to thank Supervisor Chavez for your tremendous championship to support women and girls, and particularly survivors of gender-based violence. And thank you also, Supervisor Ellenberg, for your commitment in this arena. My colleague Lydia spoke a little bit to the concern regarding the statements related to professionalization of the field. And I just want to clarify that since the confidentiality laws were included in the evidence code, there has always been 2 avenues to qualify as a confidential advocate. One is either through a master's degree, and the other one is through the relevant training and supervision. And the reason that the evidence code was built in this way is to ensure access to jobs in the field for survivors, as well as equity. So when we, there's 3 ways that an individual can qualify to work as an advocate, and I'm speaking only for community solutions. That's either having a bachelor's degree, 4 years of case management experience, or lived experience. And we don't make any distinctions in terms of pay. Anyone, again, however they come in, we want to make sure that folks are earning the same amount of money, and that we're really prioritizing bringing in individuals with lived experience and ensuring that they are able to work and live here in the county. So thank you very much for your consideration, and hopefully we can move forward and get to a place where this issue continues to be prioritized, and we have the staffing, sufficient staffing to provide for the significant need that continues to increase. Thank you.
That concludes our public speakers.
Thank you, Dave. So Supervisor Ellenberg, let me just say one little tiny minute of background on this. So I, as the chair of the Human Trafficking Commission, we started to get a lot of feedback about the challenges with recruiting and retaining staff. Everybody's feeling it, but one of the reasons that I was concerned about it in this area, well, there are actually 2 big reasons. One is that we've seen an increase in both domestic violence and sexual assault. There are kind of the 2 areas that we're seeing an increase in violent crime, or in these 2 areas, one of 2 subsets. And one thing that I think is very good about that is it also may be that people are more open to reporting now. And so we want to make sure that we're being as responsive as possible. And so that's really the spirit in which this discussion happened with the Human Trafficking Commission. I recognize that for our staff, for Carla and Rocio, and this is based a little bit on your discussions with my staff, that the intent was not to put you in the position of determining the salaries and benefits for these employees. It really was to better understand what the vacancy rates are, what are the challenges in terms of response times in those other areas that we may be seeing, that we're asking people to do a particular type of work in a particular manner that we may not be able to meet. And some of that is going to be because of recruitment, some of it is going to be retention, and there may be other issues involved. So that's kind of one bucket. The other thing that was really interesting to me today was to hear this issue around flexibility in contracts. And Susan, one of the areas that I had really, really wanted us to go, and this was years ago, was to find partner agencies that we could restructure our contracts with, so that we built in maximum flexibility with a maximum outcomes, meaning that instead of dividing up the pot of money in stringent ways, that we were much more flexible and saying, here are the services that we're going to ask you to provide. Here are how many folks we want services to be provided to. We give the agencies the flexibility to do that in whatever means they needed, so that they had the ability to move things between personnel, office, overhead, but giving as much flexibility as we could in contracts, because I think long term that treating our contract partners, particularly those who've had have had a consistently high performance as partners, I think would actually improve our ability for worker retention. And frankly, the other thing is innovation in the contract, right? Because what it means is that the contractor and our staff, if goals weren't being met, there's a sit down before the end of the contract to have a discussion, and there's enough flexibility built into the contract for our staff to be able to work with the nonprofits to be able
change and provide those services, and frankly, to learn faster, right? Like not wait a whole contract cycle to say, oh, we should stop doing that or start doing this. So the report says that, or maybe it was a reporter, somebody's notes say that the contracts will be going out this fall, the new RFP, is that accurate? And that's for the entirety of the $7.7 million investment that we make in these programs?
So all of our current contracts that have been RFP'd have been, the cycle ends June 30th. And so we will be doing a RFP for
next year.
Yes.
Got it.
Which would be for the next probably 5 years. They're typically
Got it. Yeah, that, which also makes sense, that we want to make sure we're being, that our partnerships are no longer, there's more flexibility built in. So here's what I would like to recommend. What I would like to have happen is, and I'm going to, Dr. Luna and Carla, I recognize you're going to have to talk to counsel. Like what I'm going to say, you know, there's always complications. So I just want to be respectful of that. What I would be very interested in having come back to this committee is the scope of work and for the RFPs and the strategies for building in that flexibility. Recognizing that we just went through the budget process and we set aside a particular amount of money for the contracts. Like I recognize that's the bucket, the challenge you're having is that we already voted on that. And what in the interim, what I would like to ask, and I don't think that Dr. Smith is here, but let me see, is John here? Well, Dr. Luna, I know you're a deputy county exec too, but they sometimes have somebody attached to a committee, and I think ours is John. But what I would ask is that there be a discussion between Dr. Luna, you and Carla and Dr. Smith as we go through this process, because it could have budget implications. And I want to make sure we're just thinking that through so that when this discussion comes back to us, recognizing I'm not asking you to stop the process on the RFPs. I recognize there's timelines to that. I'm really asking for concurrently in the broadest language possible for us to understand how we're addressing flexibility, recognizing there is a retention problem and a recruitment problem. And to your very important point, we're seeing it at the county too. So I recognize that, but that those are two areas where we're going to be prepared to discuss how the contracts build in the flexibility to allow for top performance, maximum flexibility, and retention and recruitment of these really important staff people. And then concurrent to that, alert Dr. Smith that there could be a challenge based on the constraints of the budgetary investments that we've made, so that at that meeting, he's here so he can participate in that discussion with us. Supervisor Ellenberg, is that okay with you, or do you have thoughts about that direction? I know, I see you're on, there you go.
Yeah. Yeah, it sounds like the direction is really to explore more flexibility in the contracts, which I think is certainly something that we should be doing. I thought that Carla's presentation was actually really spot on and noted the need for greater flexibility, the ability to review contracts during the year if they're not meeting, if they're not serving either sufficient number of clients, the needs of the organization. So I think that's all important. I want to take just a step back and really acknowledge the importance of the advocates. This role really is critical. I hear and agree with the concern, professionalization as it is narrowly defined by degrees from schools, I think can be very limiting. And we've learned so much at the county over the years with peer workers and really looking at, I don't even like to call them non-traditional, but just a broader set of experiences that can be brought to bear. So I think that that's really interesting and worth pursuing as well, especially given the difficulty we have in so many areas of identifying, recruiting, hiring, and retaining quality workforce. And I know Supervisor Chavez, under your leadership, the board has been just tremendously supportive of this kind of work, from the creation of the Office of Gender-Based Violence, which has happened since just in the 4 years that I've been on the board. I know that some of the funding has gone from, I think, around $400,000 to over $8 million. There should be no doubt that our county is committed to this issue. I would be interested in getting some additional data that would help me really understand the landscape fully, particularly in response to some of the pieces that the providers noted in their comments, such as the data on the demand for additional staffing through filling vacancies, turnover rates, or data comparing the wages of advocates here versus in other counties that might lead to them leaving the area. The data that we currently have, I think, is useful, but doesn't necessarily paint a full picture. Just as another example, I appreciated the acknowledgement in the ledge file that increasing law enforcement staffing due to greater need should come with at least proportional increase in staffing for survivor advocates, but clearly crime statistics don't capture the full need for community-based advocates, since so many survivors choose not to report. So what should we be looking at as additional metrics to quantify the needs here would be my question, really, both for kind of a universal question to the advocates and to Carla and Rocio. I think the concerns are important, and I think it's important that we have mechanisms to address them. So in addition to the upcoming RFPs, where I expect a number of these current concerns to be addressed per Supervisor Chavez's direction, do we anticipate full engagement from the providers in the monthly group conversations that are being planned to keep addressing this issue?
So I'll just say, I'll just say quickly about your comment about the pay in other areas. Advocates are not leaving the area to get better pay for the position at all.
They're leaving because they just can't afford to live here. That certainly makes sense.
Just to be clear on that. But yes, we are working closely, very, very closely. And the agencies of DVAC have been really gracious and flexible in meeting with us and working hard. They prepared a memo too, which we thought was very important to include in this. And they too have agreed on the monthly meetings. Now, typically in the contracts, they're quarterly reports that are given, and then many of the budget modifications that end up happening are done in like the fourth quarter as the contract is ending. We believe that the monthly meetings, which they would not be obligated to attend, would be a great way for us to keep on track better. And they all have said they agree to that as well, and we'll do that. And I think at least, for these next few months getting through this, we'll be able to see the trends as they're emerging instead of backtracking.
Thanks, Carla. That's super helpful. And I assume that we have transparency either through audits or through their reporting on how the money is being spent, so that we, from our end and being educated and doing this better, have a clear understanding when funds aren't spent, what the barriers are and how those might be most effectively addressed. Because obviously we want to provide the maximum support that we can, and we want to make sure that the dollars are being spent as intended, given that intent is malleable and flexible according to the needs.
Right, and I think that's the right balance, Susan, that you're raising. I think that's right. One recommendation I would make, just because of the timing, is that my office or Supervisor Ellenberg's office can ask Harvey Rose to do a subset of this work. I think each of us get like 40 hours of analysis from them. That if on a single subject. So perhaps Carla and Dr. Luna, you could work with Maya on some of the data that Supervisor Ellenberg asked about that may be a little more regional. And then the second thing I would just point out is that to the advocates, I think one of the most important opportunities that you can help us with is helping us understand what the wait lines look like, as I think Adriana raised, because I do think, one piece of feedback that I've gotten from victims is that they're waiting for services. And I think for some of them, that wait is just, it can be unbearable. And we just need to I think we understand that, but I think that those wait times are things that would help us. So perhaps Carla putting together a more detailed survey. And what I would just say to the advocates who are on that, my hope and expectation would be that we get as much information as possible to help us better, look at this problem. Does that make sense to everyone? Is there any, Dr. Luna or Carla, any concerns about any of what Supervisor Ellenberg and I just raised?
No concerns. Makes sense. Thank you.
All right. Thank you all. I know, when we made this request, I was not intending to put you in an untenable position. I was really thinking this was more of an information thing, but I recognize the challenge given that we've passed the budget. So that's why we'll have Dr. Smith here so we can have that conversation in real time and transparently. All right. With that, Supervisor Ellenberg, I think that's pretty general direction. And if we could have a motion just to the effect of asking the staff to come back to us with the outline of the RFPs that highlight the flexibility that we are building into them, along with asking Dr. Smith to join us so we can have a budget discussion if that becomes necessary. And to the advocates, this motion isn't binding on you, but it will be our request that we get the information that Supervisor Ellenberg and I asked for as part of this motion. So I will
second that. I'll second the motion.
All right. And seeing no other comments, I'm going to ask for the roll to be taken.
Vice Chairperson Ellenberg?
Yes.
And Chairperson Chavez?
Yes.
Thank you.
Thanks all. Appreciate it. Thank you for the good work. All right. We're going to go on to item 9. And item 9 is going to be housing. And so, there's Consuelo. Great. Welcome. So this item is reporting on options for housing and childcare for survivors of gender-based violence. So Consuelo.
Thank you, Chairperson Chavez and Vice Chair Ellenberg. Consuelo Hernandez, Director with the Office of Supportive Housing. And I have a member of the DVAC joining me this afternoon. Aida, would you like to introduce yourself?
Certainly. Good afternoon, Supervisor Chavez and Supervisor Ellenberg. Consuelo, hello. My name is Aida. I'm with Community Solutions. I am the Director of Intimate Partner Violence and Housing Services. And I'm really happy to be here and share the virtual stage with Consuelo.
And we do have a short presentation, and we will try to be succinct given the lateness of the hour. And I hope you're able to see my screen and the presentation.
Perfect.
And because I tend to talk very fast and forget, I wanted to start with thank yous. I wanted to thank our housing group members, Jen, Perla, Erica, RT, Cindy, Trish, Carla, Maribel, Jackie, and Reagan, and of course, Aida. We've been meeting over the last few months and feel like this is really representative of our collective discussions. And apologies, I am fussing with my screen. This is an overview of today's presentation, giving you a background, particularly because there have been a number of board referrals and a number of conversations, and wanted to make the connections in terms of what we're representing today. We'll talk a little bit about our work together, give you the landscape of housing and housing needs for survivors, along with who's being served, the capacity in our system, and a set of recommendations from the victim service providers. A little bit of background and how the Office of Supportive Housing became engaged with this subject is in April 2021, as part of a special joint meeting of the Children, Seniors, and Family Committee with the City of San Jose's Public Safety, Finance, and Strategic Support Committee, you all requested a conversation about housing for victims of gender-based violence. And through that presentation, we presented a set of recommendations, one of which was to host a housing work group that can focus on these issues and come together and develop a set of recommendations. So we have been meeting since then. I will say that the meeting frequency has ebbed and flowed because a lot of us have been busy, but I really feel that the last 6 months we've made a lot of progress. This is the 4th report, and just wanted to share again that this has been a collaborative effort, and the approach that we took was, can we set aside the referrals for a second and what we know about each other's systems, and just think about the people that we're trying to address, the needs, how we can work together rather than looking at the gaps in our respective systems and come up with a different approach in the work. And we did also want to point out one of the collaborative efforts. On the left, you see the organizations that we have been working with, and we wanted to just signal for the committee that while these agencies are representing this body of work around housing, it doesn't take away from their core mission as an organization. So on the column on the right, it's the same organizations and the people, the subcategories of survivors that they might be serving. And we wanted to, and the victim service providers really wanted to point out this distinction, that it isn't taking away, that it isn't mission creep or going away from their core, but really taking a step back and looking at survivors through the lens of like a broader lens and housing. And now I will hand it over to Aida.
Thank you, Consuelo. And so as you see, the problem statements listed, there's a lot of evidence that gender-based violence can lead to homelessness. Currently, survivors in our county do not have access to safe housing and supportive services, from crisis to stabilization to long-term stability. A comprehensive intersectional support is needed to address both the cycles of violence and poverty so that survivors can establish safety, security, and wellness. Next slide. And so I just wanted to point out that as DBAC, we did our research. We looked at all the reports already put out. And so there are several groups already in our county looking at the lack of housing and supportive services for survivors of gender-based violence. There are several studies and reports that surface the correlation between housing and violence. Additionally, several of the groups listed have developed recommendations around housing and supportive services for survivors. And again, we just wanted to point out to you that we have read the reports and that we have had deep, in-depth conversations about all the reports and what we're finding as well. The next slide. And so I wanted to talk a little bit about our housing framework. And so our housing approach consists of 4 pillars. The housing philosophy prioritizes confidential, trauma-informed, survivor-centered, empowered-based, and person-specific and intersectional services for all survivors. We meet the survivors where they are at and support them through three distinct phases that complement and build on each other. The crisis phase looks at emergency and basic needs. Stabilization focuses on increasing survivors' well-being and self-sufficiency and support networks. The sustainability phase aims to ensure that survivors do not regress. This process is not linear, and again, it is survivor-centered. To be successful, survivors need, in addition to stable housing, an intersectional coordinated support designed to address each survivor's individual needs, priorities, as well as intensive case management. No one organization can address all of the survivors' needs. Therefore, collaboration between victim service providers, housing providers, legal service providers, and other governmental and community-based organizations is essential. Next slide. While we shouldn't make any assumptions, most people think of folks who are on the street when we use the term homeless. Most gender-based survivors start from homes where violence was occurring, which makes them vulnerable to becoming unhoused. Some are in homes where they must flee to shelter or programs, such as our human trafficking survivors who are housed and controlled by their traffickers, or sexual assault survivors and their families living in shared housing with their abuser. Or that person who is a survivor of IPV that have to flee due to safety concerns. We also have survivors that we serve that are unhoused and experiencing violence from other unhoused partners or individuals. So depending on how survivors enter our system, their response is determined and placed in the system as to where they're at. So there is not one entry point that people come in. They'd all come in from crisis. Some people can start in a home already, but for some reason, violence is happening in their home, so they may lose that opportunity to stay in their homes due to income not being there anymore. So in order to be successful, we need to identify where a survivor is on this housing continuum, ensure they receive individualized and comprehensive support that they need to provide and establish safety and well-being. Next slide. A person-specific and intersectional approach incorporates the individual circumstances of each survivor and family into their housing stability plan. For example, the majority of the clients we serve are families, and there are within family populations, there is a subset of large families with 6 or more members. There are also families with children with disabilities, families who are led by male survivors or heads of household. And this is not an exhaustive list. We only want to highlight that when we look at gaps and needs through the gender-based violence lens, we look at the different populations we serve and how the needs differ within those populations. And so right now we're going to talk a little bit about the capacity that each organization or that collectively the organizations have to serve in terms of housing. So you first see there that we have emergency housing beds in the county. We have 64 beds for emergency housing. But however, during COVID, because of the restrictions, we were very limited to how many people we could actually house. So we then went to emergency housing through moteling. And so in the county, we have transitional and rental assistance programs. In the entire county to serve survivors, we have 3 transitional homes, the capacity of serving 21 individuals, including children. We have 121 rapid rehousing scattered sites in the county. We have the capacity to serve 156 individuals through the homeless prevention systems. And we have, through the Housing First program, the DV Housing First program, we have the ability to serve 164 clients. In permanent housing, we have only 40 vouchers. The next slide, please. So thinking about the available resources I just highlighted, let's now look at the actual need based on individuals housed during fiscal year 21-22 by gender-based survivors. For example, there are 64 emergency shelter beds that we have capacity to fill. However, look at the number of folks we hoteled. This speaks to the gap in resources. So we had 64 beds last year, limited to COVID. restrictions. And because of that, and because the need of survivors for emergency housing, we hoteled 575 in the county. And these are just folks who reached out to us for help. Next slide.
Aida, I'm going to stop you just for a moment. Just I need to do a time check because we're running a little bit late and we have a couple more items that are coming forward. Supervisor Ellenberg, do you have a hard stop? You're on mute.
It doesn't have to be right at 4, but by 4:15 for sure.
So Aida, I'm going to need you to go to and I apologize, I didn't see this presentation in advance because if I had, I would have said, just because it's so important, all of these are really important. But if you could move along, and then colleagues, Supervisor Ellenberg, what I'm going to do is I can give some direction on the VASC. So VASC, I won't need a presentation today. And what I would just say is on the hub, I want to give direction, and I think we won't need presentations on both of those. So just to be mindful of everybody's time. All right, Aida, back to you.
Okay, I'll make it very quick. Sorry. So can we go to the next slide, please, Consuelo? So, this is yours.
And Aida, if it's okay, Supervisor Chavez and Supervisor Ellenberg, I can run us through this rather quickly. The point of the data and the slides is to show how people are served within both of the systems, both through directly by victim service providers and through our housing, our supportive housing system. So this slide shows you, one of the big things we look at is who's becoming homeless, is that inflow number coming down, and what is the total number of placements that are taking place over time. So the column on the left shows you within our system, those that self-identified as being survivors, that inflow into our system, and then equally those that are served. We also looked at what program are they enrolled in to similarly identify the gaps that Aida was talking about. Who we're serving and in what programs, and then of those that are becoming homeless, that are survivors, what programs are they enrolled in? And what we see is in our community queue, there are currently 914 households that are reported currently fleeing from domestic violence or victims. And this shows you when the episode occurred, whether it's they're currently fleeing or if it took place months or years before. And again,
Consuelo, just on this slide, is this slide, so just this slide is within 1 year, that's the limit on this?
Correct.
Wow. Jeez.
And then when we look at the demographics of the data, it's interesting to note that we have a high percentage of single adults. So it does require more analysis, and Erica, who's on our work group, is going to do a deep dive with our data team to really start to understand these numbers, what they mean, because they shape our programs. We also are interested in understanding when a survivor identifies a disability, what are those specialty services that are needed beyond the case management. One of the things that I've learned from this group is the intervention that we currently have in our system looks at two things. If you score in the permanent supportive housing range, or if you score in the rapid rehousing range. For survivors, it's something in the middle. So we really have to, rather than thinking about changing the system, how do you create something and a pathway for survivors by piloting, leveraging Home Key, which is part of our staff report. How do we look at the Home Key program as the opportunity to build something or buy something together with victim service providers? How do we look at HUD COC funding? And you'll see the set of recommendations that we have identifies policy issues, the VI SPDAT, not the assessment itself, because we all know we need an assessment, but the questions that are asked. Who conducts the assessment? Is there a standard screening tool that we want, not just victim service providers, but other people who in our system who assess the individual when they come to, if I come to a shelter and I'm fleeing, but I don't feel comfortable fleeing, and I don't want to say that I'm fleeing, how do we educate the system to handle that type of environment or people? And then looking at the capacity, how do we improve existing workflows? So our team and DVAC has made a commitment to look at the confidential queue. So the confidential queue is currently how we house people through the supportive housing system that are survivors. And what we're finding is there's a huge gap in the system. Referrals are not coming into the queue or out of the queue in a way that our supportive housing system, regular community queue, is being handled. This is by far the biggest barrier that we've seen through our discussion. So we've made a commitment to explore changes and come back in December to report back out how we'll implement those changes to increase the number of people that are being served. And Aida, you know, a lot of the balance of this, Supervisor Chavez and Ellenberg, is related to the prior item around flexibility in the funding, flexibility in the contracts, staffing and recruitment that we're all seeing, and looking at this domestic violence housing first, which is slightly different than the way we identify and characterize housing first. Not that it's a bad thing, it's just being mindful of it. And the fact that survivors need 36 months, where our rapid rehousing program is 24 months.
Consuelo, can I just go back to the housing policy very quickly? I just wanted to mention the housing element, because I think this is a really important piece when we're talking about planning out housing developments within a city. So I think this is an opportunity for cities to really look at their housing development plans for the next 8 years and include language there that serves survivors of gender-based violence. For example, the city of Morgan Hill included specific language to their element to include survivors of gender-based violence under the section titled Provide Adequate Housing Groups for Special Needs. And other cities in the county are considering that, including the city of San Jose. So this is a really big piece, I think, in terms of moving forward and what can be part of future housing developments in cities in our county. Sorry, Consuelo, I just needed to point that out.
It's okay. And that concludes our presentation. We're happy to take questions, or given the time, we do plan to return at the end of the year with the follow-up.
Thank you. I'm going to see if there's any members of the public who would like to speak on this item. And for any other speakers for the rest of the meeting, we're going to have everybody at 1 minute, just again, to be mindful of time.
Thank you for the clarification, Madam Chair. We don't have any public speakers on this item.
Thank you, Dave. I'm going to go to Supervisor Ellenberg to see if you have any comments or questions.
Thanks. I'll be quick, Consuelo, and maybe save most of my questions for an offline conversation, but there are a few that I wanted to ask here. You noted that there are 40, the report noted that there are 40 vouchers available. Can we use the vouchers for the Heading Home campaign for families that might qualify under that subset if we don't have enough under this gender-based violence categorization?
Those are the 40 vouchers, Supervisor Ellenberg. The emergency housing vouchers, part of the Heading Home campaign, includes that.
Got it. Okay.
Great question, though.
Darn it. Not the answer I was hoping for, though.
But I will say, Supervisor Ellenberg, that this week, maybe yesterday, HUD released a new voucher opportunity. The Housing Authority is working on providing us with a summary of that voucher opportunity. And it's actually a little bit better than the emergency housing voucher because it's a project base. So we'll know more in the coming weeks how we're eligible as a community and what to prioritize.
Okay, thank you so much. The other one that I just want to ask from the dais here is really about childcare. I see that childcare is listed under basic needs. How are we meeting that need? Are we contracting out for childcare? Are we providing vouchers or cash for that service?
You know, this is a real crucial item for our survivors. One, they don't have much income because they left their homes with little or no job skills. And when they do find a job, childcare is so expensive, it's out of their reach. And the affordable childcare program, there's always a wait list for that. And so it's just a challenge. So, you know, do I pay my rent or do
Right, I know the challenge. How are we addressing it?
Or are we?
It's
Or
in the
not?
contract flexibility, Supervisor Ellenberg. That is one of the identified challenges is how do you look through the funding and point out what's eligible? So for instance, the COC grant can focus on rent and the current contracts that we have can focus on those supplemental services. So I think it's just how we pair the funding. The general funds, the non-HUD funds are always going to be the most flexible.
Yeah, and I think, Susan, that the discussion we were having in the last item, that was partly what I was trying to address is giving the agency flexibility to respond to each.
Right, and so I'll just wrap up, Cindy, with something that we have both said numerous times. When we are building housing, contracting for housing, we really need to somehow create a formal policy that childcare has to be part of the picture. We either have to be including a physical structure, licensing space, or specifically identifying why it's not needed. Perhaps if we're, housing that's all for older adults, maybe we don't need childcare, but the presumption has got to be baked into everything that we're doing, that this is a need that has to be met and that we have to identify funding streams for it.
Why don't we include that in this motion and ask staff to come back with the recommended policy in when this report comes back, so that we can take it to the full board? Because you and I have said it a bunch of times and no one's responding to us. So I think the only way to do it is let's just put it on the agenda and let's talk about it, and then let's bring it before our colleagues.
I support that direction. Thank you very much.
Great. And we'll be, I know that Consuelo, that since that's not entirely within your purview, we'll be putting that through the county exec's office so that we get the help from the Fleets and Facilities Department, Housing, and the office of our new Sarah's Office of Family and Policy. I never remember our advocacy names, as Susan's always laughing at me. Some of these I even named and I can't remember. So we'll make that part of the motion. And then what I just wanted to say, I'll withhold my comments, except to say I'll look forward to you coming back. I really appreciate the report and the slides, and I need a little more time to digest them. And so when this comes back, I think I'll be more prepared to raise some ideas and concerns. So thank you. So with that, I will make that in the form of a motion. Supervisor Ellenberg, do you want to second that?
Very much. Yes, second.
All right, motion and a second. Dave?
Vice Chairperson Ellenberg
Yes.
and Chairperson Chavez.
Yes.
Thank you.
Thank you so much. So now on our agenda, we have this item 10. And before we go to 10, I could dispatch with items 11 and 13, if that's okay with my colleague. I know these are items I had asked for. On item 11, the VASC, I just want to say I thought the report was great. The slides were great. My request for the report next month is that you come back with just the media outreach and engagement plans, because there are so many changes happening that I would really like to see a robust plan, because I think this means that we're going to have to go back out to the community, particularly as it relates to proxy meals and the like. And I think it could be just a lot of fun, and we should do it again anyway. So that would be my my direction. So and I'll just do this for the hub too. On the hub, I just wanted to say that I'm really excited about the direction, and my only question is, Jeff Draper is here, and maybe Consuelo, you can answer this, is when we're breaking ground on the new site.
Thank you, Chairperson Chavez. The date has changed. As you recall, we reported last that we needed to submit an SB 35 application, and we're waiting for the consultation from the tribal councils before we can set a firm date on when we can break ground. We'll have that for you at the next report.
And that'll be just next month. We'll know the answer. If you know the answer sooner, if you could just send us an email.
We will.
Okay, great. All right, so no, so we'll move on from 11 and 13, and we'll go back to 10.
Madam Chair, I apologize for the interruption. Just so I can note this correctly in the minutes, are we counting those as received or are you holding those items for next month?
They were counting them as received. Thank you for the question.
Thank you.
Thanks for hanging in there. I'm so sorry.
No worries.
Just a quick point of order from County Counsel's office. I don't know that there is any public comment, but to the extent that we're going to handle those items, we should offer the public an opportunity to comment.
Thank you, Rob.
And we have no public speakers on those items, Madam Chair. Thank you.
Thank you. Thanks, Rob. All right, we're going to go then to item 10, use of force in juvenile custodial settings.
Good afternoon, Chairperson Chavez and Vice Chair Ellenberg. I hope you're well today. In the essence of time and understanding the constraints that you all have today, I will answer any questions that you have for me today regarding our quarterly report on the use of force.
Great, Supervisor. Let me see if there are any public speakers on this item.
We have no public speakers, Madam Chair.
I'll close the public hearing and I'll turn to Supervisor Ellenberg. I recognize this was a referral. I think that came from you, Susan.
It was, and the report was clear and responsive. Thanks, Nick. I don't have any further questions.
You're welcome.
Then we will receive the report, and I don't think we need an action to do that. So thank you, Nick, for hanging in there till the end.
Yeah, very welcome.
All right, we're going to move on then to item 15, the Office of Children and Families Policy for a verbal report. Well, maybe I don't know if that is a verbal report.
Oops, here we go. My mute is off. So good afternoon, Chair Chavez and Vice Chair Ellenberg. Sarah Duffy, Chief Children's Officer. And I'm really pleased to be joining this meeting for the first time, and I have a status report from our office. I'll try to go fast since I know we're short on time. I have a quick PowerPoint, just a couple of slides, and I'll start by covering some updates on some of our high priority initiatives, and then I'll talk really briefly about the development of a work plan for our office. So in terms of high priority projects, I'll start off with sharing, I guess next slide, Shannon, some information on the School-Based Wellness Center study. So this study is posed to begin. We just need to finalize a contract with our consultant. My office has been meeting with the Behavioral Health Services Department and staff from the Santa Clara County Office of Ed. And so we're ready to get started as soon as the consultant is on board. In terms of a timeline for the project, by January 2023, we will have interviews done with up to 15 leadership staff from school districts in the county, as well as surveys that will go out to all of the school districts. We'll be doing some research into best practices for school-based mental health services, including wellness center models in California, specifically in the Bay Area. And this will culminate in the development of an operational action plan to support wellness centers, replication and expansion, and it'll take into consideration shared responsibility, braided funding, cost containment, maximization, and leveraging of existing services and supports. With regard to supports for children who've lost a caregiver to COVID-19, we have a contract in place between the Bill Wilson Center for Living with Dying and the Social Services Agency to provide grief counseling supports to 25 children, youth, or young adults who've lost a parent to COVID-19. Community outreach efforts completed to date include the release of a flyer on how to access the grief counseling that was disseminated through the Behavioral Health Services Department school-linked services coordinators, through the Santa Clara County Office of Education to all its school district and partner networks, and posted on the COVID-19 recovery website. To date, we have not received any referrals for grief counseling or service navigation support, although there have been inquiries for county agencies and organizations, and we'll be looking really closely at this as school is starting. With regards to strengthening efforts to build the early learning professional pipeline, we're really excited that we've finalized 3 contracts with First Life Santa Clara for initiatives to increase the credentialed early care and education workforce and provide technical supports to keep family providers in the field. So work has begun on these initiatives and we'll be reporting back on them in December. Regarding billing and technical assistance training, the Behavioral Health Services Department is finalizing a contract to support local education agencies in billing Medi-Cal and private insurers. The County Office of Education is ready to begin the training development and process, and we anticipate the contract should be done by early October for that. And then finally, with regard to the Universal Access Program pilot, we're in the process of amending 3 agreements to add funding to the project from January through June 2023, so that it will cover a full school year. The services under the pilot this year will include 3 school social workers at Franklin McKinley School District, a preschool teacher for the co-op preschool at Painter Elementary School in Alum Rock, Family Resource Center at Painter Elementary in Alum Rock that will provide support to co-op families, and housing and navigation supports to families in Alum Rock and Franklin McKinley school districts. The UAP leadership will be meeting regularly with our office this fall to discuss actions being taken at each of the school districts to sustain key elements of the UAP model in this final year of the pilot. Okay, so next slide. And then I just wanted to close out, and I'll be brief, with a report on next steps for our office. So over the next few months, I'll be working to finalize a vision statement for our office, as well as a detailed work plan outlining priorities and projects for the year. The vision statement and work plan will really be grounded in ensuring the well-being of children and their families so that every child has what they need to be successful. And I think key components of the work plan will cover advocacy through sound policies, collaborative partnerships with community and county partners so we can identify service needs, data and evaluation that will allow us to track progress, hold the county and our partners accountable, recognize redundancies, and of course, elevate and scale innovative practices. So I'm really excited to be working with this committee, given the dedication to children and family well-being, as well as the board as a whole. And I'm looking forward to leveraging your vision, as well as those that I've been looking back at in the Children's Bill of Rights, which identifies the outcomes of well-being that we hope to accomplish really for every child. So as I build the infrastructure and staffing for the office, right now, our priorities are hiring some analytics support. And so I really look forward to increasing our capacity to tackle these issues and make really strong strides towards increasing opportunities for children and families. And that concludes my report out. I'm happy to answer any questions you have.
Excellent. So first of all, I do just want to say welcome. And I want to say this has been a labor of love, both for Supervisor Ellenberg and myself. We launched this establishment of this office in January of 2020. And so seeing you here is very meaningful. I am very excited about the work plan that you're working on. What I would like to request is that our meeting in September, that you come forward with just what you're learning and where you're at. And it's okay for it to be not baked. That's really not the point. I'm super excited that you're going to be working to pull together all of our partners. I think we see you, Sarah, as the leader, and we want you to pull together, the cities, the county office of ed, key partners in our nonprofit sector and community-based sector. Actually, as part of a special meeting we did some time ago, we were really asking for a work group to be put together so that we could really pull together best thinking, both for the shape of the office, but also I think to attract leaders from different parts of the organization that really want to play a role in us being all about the littles, right, as a county, because we, I think, understand that until we get into the prevention end of the pool, we're going to keep, like, we're spending on the intervention, and at the end is just something that, really, if we can figure it out, we're going to be a very special place. And the other thing is, just to be frank, I think issues around childcare in particular, I'm sure Supervisor Ellenberg is going to lean in, but there are a number of areas where there's a lot of will, but not enough infrastructure for us to get the work done that we want to get done. So with that, I'll look forward to seeing you in September, but I wanted to make sure Supervisor Ellenberg had a chance to weigh in.
Thank you so much. And Sarah, welcome. It's nice to have you at your first official CFSC meeting. I appreciate the update on the Wellness Center planning, and I just want to offer a little bit of direction as the work launches. I want to be sure first that we are building on prior assessments already conducted in this space, including the RDA study in 2021 and surveys of district needs that were conducted by the Office of Education. I want to make sure that we incorporate the planning underway through state-funded school-based initiatives that will involve the managed care plans as key funders. And third, that we focus this effort on developing a tangible operational and funding plan that has clear recommendations for implementation. I would be interested to see the board move forward on a clear path for expansion in the next budget cycle. So it's critical to me that the work stays on schedule and that the findings direct clearly what our next steps should be. But I'm really excited about the start of the work. So that would be my motion.
Second, with all the other stuff I threw in there. Good. So we will see you back in September.
Sounds good. Thank you both.
Happy
Thanks, Sarah.
Thank you.
All right. So we're going to go to our colleagues that have verbal reports. And
Madam Chair, my apologies for the interruption. We have a motion and a second, but we didn't take a vote on that item.
gosh, I'm sorry, Dave. And we don't have any public speakers.
There are no public speakers. No. Vice Chairperson Ellenberg?
Yes.
And Chairperson Chavez?
Yes.
Thank you.
Dave, thank you. We have reports from our Chief Probation Officer, so we have some verbal reports. If we can get very brief verbal reports, if they're still with us. Let me see, is Chief Garnett still here?
It looks like Chief Garnett has left the meeting, Madam Chair.
I'm here. Assistant Chief Burcher's here. Sorry, I can't now get the video.
No problem. Did you have a report?
And just a real brief report today. We had an academy graduation today that the chief and I was at. It was absolutely wonderful and beautiful to see all these young new people coming on to our department. It'll certainly be representing us and providing services to the community for the next 30 years. And so it's just so nice to see, and they're so happy, and their families were there. It was really a wonderful celebration. I hope someday you get to come to one of them, because it's just really a fantastic thing to see. And that was it. We just wanted to let everyone know that we're still moving forward. We're hiring people and really trying to strengthen our department for the next 30 years.
Thank you, Nick. Appreciate it. Appreciate you being here.
Sure.
Deborah?
Good afternoon. Quickly, good afternoon, Chairperson Chavez, and also Vice Chair Ellenberg. Just briefly, we've been allocated Deborah Porche Usher, Interim Director for Social Service Agency. Just a couple of things. One is we've been allocated a non-competitive funding for the digital divide for seniors. And so we're currently working to develop the plan with the Senior Commission. And so we look forward to bringing that plan to you to get your input as well. And so to let you know that as well. Currently also, we're partnering with our partners at Behavioral Health and also Juvenile Probation to apply for a crisis continuum of services with CDSS. And I think that's really relevant based upon the conversation we heard earlier. So that's it for us. We look forward also to bring information to you as to the progress on that as well.
Thank you. And Deborah, thanks for stepping in there. Really appreciate you. Thank you. Ignacio.
I actually do have something, but it is not time sensitive. So in the interest of time, I can carry it over to the next meeting.
All right. Thank you, Ignacio. We really appreciate all of you being here. We're adjourning our meeting. Our next meeting is September 22nd at 2 o'clock. Thanks all. Thanks for hanging in. Dave, especially to you. Thank you.
Thank you.
Thank you.
Good evening.
Recording stopped.